Welcome to a new Between Two Curtains podcast episode, produced by Red Noses International, as part of our activities for European Mental Health Week 2026. This year, under the theme Stronger Together, Prioritise Mental Health in a Changing Europe. Are the arts a missing link in European mental health care? That is the question we are putting on the table today. And to explore it, I'm joined by Amir Shahid, an arts and health consultant based in Switzerland, working with the World Health Organization, the Jameel Arts and Health Lab, and the European Commission. He combines a PhD in public health with a passion for music and is intrigued by how shifts in culture and attention can help address individual, environmental, and societal challenges. Amir, welcome. Thank you so much for joining us today on the podcast.
Thank you for having me.
It's my pleasure. Where are you joining us from?
I'm joining you from Zurich, Switzerland.
Beautiful. So I will already dive into the first question for you, and that is that you've built a career that sits at a very unusual crossroads to this point. Biochemistry, environmental engineering, public health, as well as the arts. So when did you first realize that these worlds weren't as separate as they might seem?
Thank you for that question. It's one that's very significant for me because in many ways they do seem different, but that's because the underlying question is actually what connected them rather than what they are in and of themselves. And I think my career, if I can even call it that, it's more of a journey, has been informed by a question which was much broader in nature and which was kind of one of those big ones. That's why is the world the way it is? And what, if I refine that a little bit more, it was something around looking at complex challenges from poverty to climate change to health inequalities and trying to understand what I should learn to be able to address those problems. And so I went through what I thought were solutions because they provided very strong tools, understanding the natural world through an understanding of biology, chemistry, physical systems in the body, understanding water, sanitation, hygiene, the sort of environmental context in which we are. And each one actually ended up being a broader epistemological circle, as it were. And interestingly enough, the broader I got up from biochemistry to public health, the more I became aware of something that was really at the core of those, which was humans. How we pay attention to the world, how we make meaning of the world. Because a lot of the problems, the way I see them, from climate change to poverty, they're not an absolute, unequivocal, unchangeable natural system or state. They're choices that humans have made collectively and individually. And when we look at those, we have to get down to things like culture, to the water that we swim in. How do we make sense of the world? Should we just be maximizing our self-interest? Should we just be growing things as fast as possible? Should we address things by cutting them off from their whole? And increasingly this kind of drew me to the power of culture, because I've also been an artist. I was also a very keen musician. I was always very interested in that space and in how paying different attention to things without using my rational mind could be so generative. And so both of these interests, along with my PhD in public health, brought me to an interest in what does culture have to say to the world today, to complex challenges. And I was very happy to see that there's now been a growing space within the world of public health, which is what I studied the most, that's been looking at the world of culture and arts engagement. And that's where I find myself happily in today. And I'm very interested in how different modes of attention, how different multiple modes of knowing, how culture as a whole can contribute to both healing ourselves, but also the planet.
Great. That's really fascinating. And you're so right in saying that, culture is a fundamental part of everything we do as humans. And it's a really interesting and new approach. So looking back now, was there a specific moment on this journey of yours where you witnessed the arts doing something for someone's mental health that no clinical intervention could have delivered? So something that would have been very hard to measure, but impossible to ignore.
Yeah, I think there wasn't any one moment, but I can think of a few very short ones. One of them was, I remember a story by Carl Jung, the famous psychiatrist, psychoanalyst, realizing that in order to get across to one of his patients, he had to stop trying to speak, again, analytically to that patient. And his breakthrough happened by simply singing a song to this person. And that was where the floodgate sort of released, and she had this massive cathartic moment and could start reconnecting to her childhood, to her identity. I used to live in Mali in West Africa, and over there, so music and dance are very intertwined in a lot of other cultures in the world. I think they were also similarly intertwined in Western culture at one time, but that's been quite disconnected now. But we still see this very practiced in a lot of other places in the world, including Mali. And there are regular rituals involving song and dance, which are done in sort of neighborhoods or in a specific household. You can call these people to come to your place. And typically, a psychoanalyst might say that this was to solve a mental health issue. But what you see is the power of the song and dance releasing energy, providing catharsis, providing a narrative of meaning that then has lots of psychological impacts on people and completely relieves them of certain things that they've been going through, certain behaviors that they've been exhibiting. And then I think I saw it in my own life, releasing difficult moments through song, through crying while I was singing, through dancing through something. And I saw a very strong example in an area that's quite related to the topic that we're discussing today in humanitarian contexts. Action for Hope is an organization that works probably in very similar contexts to Red Noses. And I was writing a story for UNESCO on this organization, working with refugees in a region of Syria, which had been very affected by war, by recruitment for fundamentalist groups and all of this. And they found that by going into a village that had been very involved in recruiting most of its men to fight, by going in with a theater troupe and showcasing very simple stories through participatory theater of how people were engaging with their loved ones who were in the war. Simple stories of a mother bringing a favorite food to her child, or a sister calling her brother who was on the front line. Simple stories like this led to, amongst other things, contributed to a shift that led to that entire location negotiating terms of settlement with the government and saying, we don't want this anymore, because we're seeing the impact of what this is doing to our community in a way that we hadn't seen before, or hadn't felt before, rather.
That's beautiful and really fascinating. And I guess also it's a method of really building community and coming together through these different artistic modes of expression that you mentioned, song and dance and theatre. And that's also a really powerful mechanism for it. So that's fascinating.
Indeed.
Moving on to our next question. The WHO defines health as not merely the absence of disease, but a state of complete physical, mental, and social well-being. How does that definition shift the conversation when we talk about what mental health care and healthcare in general actually needs to look like in Europe today?
I think many of these definitions were really well designed. When we look at the WHO definition, it says it's a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. This introduces concepts of health being physical, but also mental, also social. So we start to look at it in a systemic way. When we look at other definitions that are implied in this one, like mental health, it's a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to their community. Well-being itself is described by a state in which, similar to health, it's a resource for daily life and determined by social, economic, and environmental conditions. So what I love about all of these definitions is that they give us a very holistic view and a systemic view and an ecological view almost. So you can see these sort of rings going from the inner world of an individual to their physical world, from that individual to their social world. And so I think, in short, it sort of shifts the focus from treating illnesses in individuals as a broken body part to understanding a person in their whole self, inner and outer, and understanding how it's produced socially, structurally. I think it also brings in the importance of relationality, how we are in relation to, again, both our subjective understanding, our inner world, as I say, and our outer, how we are in relationship to the environment, how we are in relationship to our structural situation. And hopefully, this helps us see a model of health and well-being which moves. This is the shift that I think the space of arts and health is really occupying amongst other disciplines. A move from focusing on just what we call pathogenesis, like the elements that contribute to disease, to salutogenesis, so the elements that prevent us falling ill, and think about health generation, right? And to do that, we have to see things as a whole in this way.
Yeah, that's exactly right. And we all know that mental health has been historically sort of deprioritized or underestimated. So it's nice that society seems to be catching up a little bit there. So within that framework, where do the social determinants of health, things like loneliness, economic insecurity, lack of cultural participation, sit as risk factors for poor mental health? And are they being adequately addressed in current European policy?
In short, social determinants, which is already a great way to look at health, because you're looking again at all the conditions in which we are born, live, work, happen. So this is seen as an important part of public health. But when you look at mental health in particular, the overlap is huge. They're not just background factors when we talk about mental health. They can really be seen as primary drivers for mental health outcomes. A huge preponderance of the mental health burden, consists of things that are connected to stress, to anxiety, to depression, to loneliness. And these things are very closely correlated to social determinants of health. When we look at social determinants, we speak about, again, the conditions in which people are born, grow, work, and age, their access to power, money, and resource. And so many of these upstream factors are related to education, poverty, to your isolation, the level of inequality that you have been subjected to, which then leads to things like your health behaviors, diet, smoking, drug use. So they're extremely connected. I think the relationship is also bidirectional. These social conditions, they can trigger and worsen mental health conditions, but poor mental health can also lead to a downward shift in job loss, housing instability, again, behaviors. Many people who may have not had a lived experience of this felt this collectively during COVID, for example. I think we see this connection increasingly, and what's nice to see is that this is being recognized increasingly at the level of European policy. So, as you said, we're starting to see this shift, and I think the narrative is changing, including the fact that we're having this conversation today. I would say that European policy is aware of the importance of social determinants in mental health. They're aware of seeing mental health within this larger ecological framework, within this larger perspective that involves structural determinants, and have, explicitly identified things like equality, equity, access as being, key elements to look at within these policies.
Okay, that's great to know. And awareness is a really great and important starting point for the trajectory, I guess.
Yeah.
So bringing it slightly back round to what we do here at Red Noses. So Red Noses healthcare clown artists draw on a wide range of artistic tools, from physical comedy, improvisation, to music, movement, and sensorial play. So when we talk about the active ingredients of arts, what do the arts actually do inside a person physiologically, psychologically, and socially? And what is it within the arts that causes this positive impact?
In a nutshell, we would say that that engaging with the arts brings us into a complex, multimodal activity that involves multiple modes of knowing, that's having lots of different effects at the same time, that's affecting the individual as well as the social and environmental context that they're in. The word you used, active ingredients, is referring to work by some of my colleagues, Daisy Fancourt, Katie Warren, many other researchers. A lot of this has been taking place at UCL, and they have a very handy model which sort of helps us grasp what is something that is much more complex than just thinking of it in terms of, ingredients like you would a drug or something. But it is very, very helpful. They have a framework called the INNATE framework, which is looking at the ingredients in arts and health. And it breaks things up into 3 broad categories. So you can look at the project conditions, the conditions around the people or the participants, and the context. So, for example, we study the project. So, what art form are we using? How is it designed? What are the resources involved? What kind of sensory stimuli does it get going? Is it working on your physical motions? Is it working on your cognitive and creative stimuli? Who are the people? Is there social diversity in this group? Are there informal social exchanges? Is there a large group, a small group? What style of practice is taking place? And then the context, how are you recruiting people? What are the economic resources? What is the environment and atmosphere in which it's taking place? So they have a model that kind of breaks down the different elements. So, you can kind of this is expressed, the active ingredients is expressed as a model of arts engagement, which leads to various mechanisms, psychological, biological, social, and behavioral, which then lead to specific health outcomes. So the active ingredients is what I described by the people, the participants, the context. And then if we look a little bit at the kind of mechanisms that are taking place, again, there are many and they're happening all at the same time. We can break it down in a physiological, psychological, and social, body, mind, and sort of people, if you want. And here we see, for example, so from a physiological perspective, reductions in stress-related pathways. Regulation is a very big word that comes up in this. Engaging with the arts helps us regulate our cortisol levels, our autonomic nervous system responses. They can modulate arousal. They can provide calming and stimulating effects. They can give us a sense of control over our emotional reaction. They can support emotional and physiological regulation. They entrain sensory motor engagement, both your mind and your body, right? Your nerves and your sense of awareness. They entrain and synchronize. So you can hear rhythm and your heart starts to change its synchronization to work with that. We see incredible impacts on brain aging, biological clocks, neuroplasticity. So that's at the physiological level. There's a whole host of ways that we can see its impact psychologically. Of course, it induces aesthetic pleasure. It can facilitate sense making. It can cultivate emotional regulation, amplify positive and reduce negative emotions, help with cognitive flexibility, change our levels of motivation and learning. And then there's the all-important social part. This is a huge aspect to the arts, which is that it develops social connections, activity, relationships. It can give a safe social space. It can support social learning. It can build social skills and resources. It can create a sense of bonding and synchrony. In short, no one aspect of this is the all to focus on. It's also not that the arts are bringing something that you don't get in other activities. It's that it happens to be a very powerful, multimodal, multidimensional way of doing all of that, which arguably adds the aesthetic side, the aspect of beauty, the aspect of us engaging in something in a completely different way of paying attention, which is probably quite different to almost any other thing. And is deeply human, which I think is also something that's a word that people who work at Red Noses, for example, are very aware of, humanizing healthcare. So that's a little bit of it, and you can find a lot more information if you look out innate frameworks, active ingredients in health, multi-level frameworks for understanding these kind of mechanisms of action.
Really, really fascinating. And I think people potentially underestimate the physiological implications of it that you were describing, that it can have such a profound impact on really every area of a person's being. So thinking about all of that from a research perspective, how does arts, humor, play, and human impact mental health? And what does it do that more traditional clinical approaches might miss? So how would you explain that to a skeptical hospital director or a health minister who wants to see the numbers before they actually believe it?
A lot of what we just discussed explains a big part of that question, right? So we're seeing how these things work. We're subjecting them to rigorous analysis and research in terms of active ingredients, in terms of mechanisms of action, and in terms of health outcomes. In terms of the evidence base, it is already significant, it's large, and it's growing. So there have been some large landmark studies. One of the biggest ones that we often cite is a 2019 report published by the WHO, a systematic review with over 3,000 different studies that were assessed, and where we found very clear indications of the role of the arts in preventing illness, in promoting good health, in treating and managing disease. We've recently, with colleagues at the Jimmy Larson Health Lab, the WHO, its various collaborating centers, published a series in The Lancet, which is one of the most preeminent health journals in the world, which is articulating a lot of this, which includes systematic reviews on non-communicable diseases. It includes a lot of very specific outcome measures. So to the skeptical person, we can say that the evidence is there that this is a powerful complementary way of improving health and well-being. It is not just your typical alternative care. It really responds in this multimodal delivery for well-established health processes and outcomes. It's addressing, like we said, everything from emotional expression to regulation to identity to meaning making to social to cognitive development to neurological development, doing so both individually and collectively. It's there, it's just complex, and it doesn't fit necessarily in the typical language of a lot of health. And there's a large diversity of mechanisms, of types of studies, of qualities of research. So there's still a lot to be done in terms of consolidating that, in terms of getting a common language, in terms of making the language a lot of these impacts, which don't fit into just your blood pressure, and speaking to these more subjective aspects of identity and meaning and self-awareness and social connectedness, loneliness. So there is still some work to that. And a lot of it has to do with just being open to that, actually. And I think a lot of it requires more than just evidence and experience of what we're talking about. And this, as we've seen, is a huge aspect that can really change the skeptical person, is if they can join in a participatory session, if they can see a group of people. I work, for example, with mothers that have postpartum depression, and we do singing groups with them. Just bringing somebody into one of those sessions can really allow them to see things in a different way and to be more open to some of these other ways of looking at health and well-being.
For sure. So on to the next question. One of the most fascinating frontiers in this field is arts interventions in crisis settings. What does the science say about why the arts work precisely when people are at their most vulnerable? And what are the challenges to measuring that impact in practice in crisis settings?
Yeah, this is a really significant, very timely, very relevant area today. There seems to be a crisis everywhere in the world in many ways right now. Here too, we do see a huge role actually for cultural interventions, for artistic interventions. The organization I cited at the beginning of our conversation, Action for Hope, they have a thing that they call cultural convoys, where they go into refugee camps, which are, much more used to seeing people come with bags of flour and water and things like that, but they come equipped with easels and films and things like this. And what we see, amongst other things, is a huge role in addressing expression, trauma, non-verbal approaches to basically what you've been through. right? Restoring agency and control, creating psychological safe spaces, strengthening social support, reducing stigma, supporting development for children who've come into an area that have just gone through some serious trauma. Playing, drawing, storytelling can help them address what they've just gone through, restore a certain routine, bring a soft entry point to then, dealing with more analytical mental health services. It restores a sense of identity and dignity. It builds social connection, creates safe spaces. I think this is a big part, actually, a beautiful space for emotional containers and where people are listening and allowing you to express yourself. It supports agency and voice and again, a human holistic health impact. So we see this Red Noses, of course, have a lot of experience in this. Emergency Smile, which we may speak about a little bit later. The world of health clowning really understands this, the power of going into a Ukrainian school or in a shelter and dealing with young children, dealing with even the elderly through humor, through creative activity. It both connects them, it allows them to offload light, it allows them to understand what they've been through, give them a safe space for that. These are very challenging, though, as you say. So this is difficult. We're dealing with unstable contexts. People are coming in and out. They're moving very quickly. There's an ethical question of, as a person who's facilitating this, do people feel forced to engage in these artistic things? Or is it dangerous, in fact? Because could you re-traumatize people if you go at it too hard? There's a lot of sensitivity which is required. There's an extreme diversity of cultures often. So maybe, certain ways of engaging with people may not be appropriate. Others, maybe you have to be extremely sensitive. There are important risks. You don't want people to be exposed either in terms of, sharing what they've been sharing creatively. There's the difficulty of starting something and then stopping because it's an emergency context. But overall, we see that these are really, really effective, really powerful ways. And we see in some of the research which is taking place right now that we're bringing a much more methodologically sound approach to this, and we're getting really great ways of circumnavigating a lot of these challenges.
So Red Noses International and the Jameel Arts and Health Lab, in collaboration with WHO Europe, are currently running a pioneering research study in Lesbos, looking at the physiological impact of healthcare clowning on unaccompanied migrant children and the aid workers supporting them. What does a project like that tell us about the future of how we design and measure arts-based mental health interventions in humanitarian contexts?
I must preface this by saying I'm not an expert on this project, but it is, I think, doing really important work. So we've got a lot of mental health challenges, of course, in this context. Refugees coming to the Aegean Islands. It's one of the primary areas for this, for migrants in Europe. People are coming from deep trauma, anxiety, depression. This is also affecting field workers and, who are themselves often at risk of burnout. And what's great about this Emergency Smile research project is that it's looking at both the migrants themselves and at the health workers. So we're kind of understanding both. And what this helps us is providing a very high quality study to a context which is not often studied because of all the difficulties that we described before. It's kind of setting a new standard for how we can explore getting good evidence, good mixed methods designs that capture this in very challenging settings, understanding both the impact of arts interventions on vulnerable populations and on the health workforce, which is really important. And they're doing it using a really great series of measurements, which is also something that's been lacking. They're looking at well-being, social connection, stress across different populations. And so it's generally setting a really good standard for the future and providing us information that might be necessary, unfortunately, increasingly in a world with so many humanitarian challenges.
It sounds pretty groundbreaking in the way that you said it's measuring things that aren't normally measured and really setting the precedent for things like this moving forward. So bringing the topic over to European Mental Health Week, the theme this year is collective resilience, being stronger together and hope in times of crisis. So these are all, interestingly, some of the things arts and community programs are uniquely good at generating. What would a genuinely cross-sectoral approach to mental health in Europe look like in practice? One for where, example, cultural ministries, health systems, NGOs, and arts organizations were actually working in an integrated way.
Yeah, I think that's really important today. And we are seeing good ones starting. We're starting to see good initiatives in this space. A truly cross-sectoral approach needs to really be that. It needs to really be done with collaborations between sectors, with co-production, with artists at the same table as scientists, as researchers, looking at mental health as a shared societal outcome, not just clinical, one which is truly integrated at the level of funding, at the level of collaboration between different institutions, which creates joint commissioning, investment in prevention and well-being, not only treatment, with shared outcome measures and measurement frameworks, with community co-production. We are starting to see that there have been reviews of policy documents, and the most powerful ones were those where ministries of health, culture, education really came together. We've been seeing this now in the comprehensive approach to mental health at the EU level, which is explicitly called for this. We're seeing things like the EU Horizon grant, which is explicitly opening itself for culture and health being funded together. There's been a recent EU report, it was the OMC report on culture and health, which provides frameworks for what a joint policy would actually look like. A big part of that is obviously the funding. But when you create, as we're seeing now, the possibility for a grant that can bring multiple people together, when you're creating the possibility, you have a culture output that includes health in it. You have a health output that includes culture in it. This already just opens up the ground in a massive way. So we're starting to see that.
That's exciting.
Indeed.
So organizations like Red Noses have been making exactly this argument for over 30 years, that humor, play, and artistic connection are not peripheral to care, but central to it. And they've been advocating for this at the European Parliament and beyond. As someone who works at the intersection of WHO policy and arts research, do you think Europe is finally ready to act on the evidence, and what would that look like?
Yeah, I think we are seeing that increasingly. So it looks like what's starting to happen, and there's still a lot of room for progress, of course, but we would see things like routine commissioning of arts and play-based interventions in care system. We'd see more of this reflected in the education, both in the culture sector and in the biomedical sector, in the health center. We would see mental health and psychosocial support pathways, including the role of culture, joint funding streams, metrics that include well-being, social connectedness, loneliness, things like this, and good quality control, good training for arts-based and relational approaches in health. And again, we're starting to see this. The EU Work Plan for Culture has explicitly spoken about arts and health. This OMC report is providing this, the comprehensive approach to mental health in Europe, the WHO's comprehensive mental health action plan, and funding all start to have this. Of course, what else do we need? It's not just evidence, it's not just policy. We need incentives to shift. We need to shift cultural shift to, valuing well-being over just efficiency, collective flourishing over just individual, and understanding of relational and connection over just optimization. And that's the one which is slowly starting to shift with public discourse, with the kind of conversations we're having now, with greater awareness, and probably with more difficulty, because that kind of does open us to the need for this, in our individual lives.
Yeah, definitely. But it's reassuring to learn from our conversation today that change is coming. It's on the way. And yeah, we can hope that it's on a good positive trajectory. So finally, for someone listening to this podcast who isn't a researcher or a policymaker, but is just a person trying to protect their own mental health or support someone they love, what is the most important thing you would like them to take away from everything we've talked about today?
It's just that there are so many different ways of paying attention, different ways of knowing. We spend so much time in one part of our heads, in this sort of rational voice that's telling us things, and when we engage in the other spaces, we can kind of realize that maybe some of what the stories that we were telling ourselves about what's really important is not, and things that we didn't think were important are. That meaning and narrative is really powerful. That maybe at the level of our conscious awareness, we need to retell stories that are very powerful. Retell our own stories, retell those of our collective, but also that there's things where we should really seek to get out of the whole space of talking and thinking in words and all of that, and engage again in the nonverbal, in the ineffable. The sort of banner that people in my space are trying to sort of make more known is, just that engaging in culture is a health behavior. Arts engagement is a health behavior. And to health colleagues, that we need to focus more on salutogenesis. How do we create health? How do we humanize health?
Great advice. I'm going to try and put it into practice myself and tell myself some nice stories in my own head.
One more for that is just colleagues in Australia have actually worked on a culture dose, and they recommend that even 2 hours a week is really improving for your mental health. So that would probably also be another take-home. Okay. Try and get 2 hours of any creative work a week.
Perfect. Fabulous advice. And I want to thank you so much for joining me today and for this really insightful conversation. I for sure learned a lot, and I hope the listeners did too. Thank you so much, Amir, for joining me today. It was a super insightful conversation and a real pleasure to have you with us.
Thank you.
This has been Between Two Curtains, a podcast by Red Noses International. I've been your host, Molly Perkins. Music and editing is by Kata Bitoft. You can find this podcast wherever you listen to podcasts. Thank you so much for joining us, and until next time.